to Tell Us Where It Hurts, a conversation around health, well-being, and the many ways people across central Indiana are offering a helping hand. I'm your host, Chris Kirschner, and today's conversation is about income disparities and healthcare access.
I personally think that the amount of income you earn shouldn't affect the amount of health care you receive. There's so many external factors that can impact your ability to have a well-paying job, and things that are outside of our control, layoffs, pandemics.
I think there are elements of healthcare that might lean more in the direction of by choice, elective things that I think people who have money should have access to. But I think in terms of basic care and basic security, no, that shouldn't be dependent on income.
My mom's a nurse, my grandma's a nurse, so they see it all the time where healthcare is not always fair, and I think that's something that needs to be more talked about.
Joining me in this conversation, Alicia Baker. She's the Indiana Community Engagement Manager for FindHelp.org, a nationwide social care network that helps connect people to social service with dignity and ease. In her role, she supports community organizations across the Midwest to maximize the tools that FindHelp.org offers. And Brian Tabor. Brian serves as president of the Indiana Hospital Association, a chief advocate for hospitals and their patients, and represents the interests of about 170 Indiana hospitals. Brian currently serves on several governing boards, including Covering Kids and Families of Indiana, the Indiana Health Information Exchange, the Sycamore School, Q-Source, and the Indiana Fiscal Policy Institute. Alicia, Brian, thank you so much for being here.
Thanks for having us.
Thank you.
So we're talking about income disparities and healthcare access. So let's start first with income levels and how does it directly affect a patient's access to healthcare? Brian, I'll start with you.
Well, thank you, Chris. So I tend to start with coverage. I think there's much more that we'll probably get into when we talk about access because coverage itself, health insurance essentially, doesn't guarantee access. But one thing that I think we almost have to start with in the conversation about Indiana specifically is that we do have a program, fortunately, in Indiana that greatly expanded health coverage to the working poor, to many, many Hoosiers. So the Healthy Indiana Plan, which was called HIP 2.0 when it was launched, was a dramatic expansion of kind of a pilot program, if you will, the original Healthy Indiana Plan. And really, as part of the Affordable Care Act, states were offered some additional funding to expand coverage, and Indiana found a way under then Governor Pence to expand this Healthy Indiana Plan. And right now, in this pandemic, we've exceeded the projected enrollment, the maximum enrollment we thought we'd have in that program. There are almost 700,000 Hoosiers who right now have the security of that Healthy Indiana Plan. I can't imagine what states right now are doing to care for their citizens to provide that security where they don't have a program like the Healthy Indiana Plan for the less fortunate and those in the lower income strata. So I really start there because I think that's been a monumental achievement, and I'm sure we'll get into more. But coverage is one place that I always start with.
Alicia, what are you seeing from your end?
Yes, and in addition to coverage, what you mentioned too is just the access side of it as well, because coverage is like the first hurdle and then access is the second. Prior to coming to Find Help, I was working at the Bonner Center here on the Near East Side in Indy, and sometimes it's just about overcoming hurdles of knowledge. If people don't even know where to go, people don't even know what's available to them or where they can go to get treatment. And so a lot of that is what we're trying to work with in our partnership with Community Health Network and lots of other organizations across the state to make sure that people just know where to turn and then have accurate information at their fingertips.
So if they have more coverage, you have programs now that are offering more coverage. We're trying to provide education as to where to provide that access. Are we seeing results then? Have we seen results since all this has come into play?
I think so. There's been quite a number of studies of the Healthy Indiana Plan that have demonstrated that with the appropriate wraparound services, as Alicia said, coverage by itself is not the solution. But when you have the opportunity for healthcare coverage, and then you have groups like hers. I serve on the board of a group covering kids and families that works statewide to try to connect people with coverage and navigate them through, because healthcare coverage and insurance, they're complicated too. So I think when we look at how the whole state of Indiana has responded, we've seen that people that have gained this coverage are able to make more informed decisions. So less use of the emergency room, more use of preventative care, and so forth. So I think there's a lot more we can do. And education, I think now, since we have a vehicle like the Healthy Indiana Plan, where we really need to focus now is on that consumer and the consumer education.
Are there certain, population pockets, if you will? Are there certain segments of the population that are going to have more difficulty than others, where we're seeing more of those disparities?
Yeah, I've noticed there's obviously lots of different groups of folks that we're doing outreach to and trying to make sure that they're educated and have access to these resources. I would say, rural communities are first thing that come top of mind, of just there sometimes aren't the wealth of resources that are available in more urban centers. And so how do we grow collaborations between health services and social services and faith communities and whoever's in the area to help provide more of that holistic wraparound approach to those communities. Also, of course, we've got lots of communities of color that have been disproportionately affected by racism and systemic issues throughout time that have been left out of the conversation or excluded. And so we want to make sure that we're making up for the things that we have done historically in the past, and making sure that we're creating paths forward for them to, improve their own lives and their own futures. The working poor, I could go on and on. We've got this whole set of people too that are, asset limited, income constrained, but they're employed. To throw out the Alice term that I know everyone's talking about, that group is also very vulnerable. And so we've got a whole lot of things that we're doing, like Brian mentioned, to work together to provide those wraparound services and social supports to help people not only with their physical health, but also all the other things that impact that health as well.
I just would add, I think that's what groups like Alicia, the work that they do, it's so important, because like a lot of things, healthcare is very local, and to be able to kind of gain the trust of communities to get people to come forward and sign up for some of the programs that are available and to help them navigate, that really does take that local touch, understanding the different communities. I mean, you touched on rural. Indiana has some particular public health challenges in some of our rural counties where there's a high Amish population. We look right now, our vaccination rates in some of those counties are very low. There are some unique other public health challenges that are faced there. And so what we see across the state is our member hospitals really have to kind of target, communicate in different ways than they might, electronic messaging, digital messaging is not effective. And so it really takes, using kind of print information, going to those meetings, talking with church elders and those communities. So you have to have different strategies, and it really is there's no one size fits all approach, I think.
You mentioned, vaccines, and I always, through the course of our discussion since we started this podcast, you can't help but say, what impact has the pandemic had
right.
on the work that you're doing across the board? And so this is another situation of how has the pandemic shifted the way we look at access, or that we're providing access, or that people are getting access to healthcare and hospitals. And you talked about communication has had to change a little bit. So what other ways has it shifted? Are you seeing either good or bad?
Looking at the data we have so far throughout this pandemic, it was very clear that the health disparities that exist were revealed, laid bare by the ravages of COVID. And so we've seen that a lot of the information about race and ethnicity, and in terms of the mortality rates and morbidity rates associated with COVID infection. So we know that there are those challenges. So I think what we've seen now, kind of looking back at that, are not just how we address COVID, but that we realize we have to address those underlying conditions. So I think we're kind of fighting sort of almost two epidemics in a way. We're fighting COVID, but realizing that within some of our diverse populations, there are these underlying challenges, chronic conditions, a reluctance to seek primary care. We've got to address those at the same time. And that's a challenge right now because resources are strapped. But I think we realize as we go forward, you have to work on both tracks.
Yeah, I absolutely agree. And Brian, you were hitting the nail on the head when recognizing that there already was like a cavern in access to care for certain populations, and the pandemic has only deepened and widened that for folks. And so a lot of what you're saying here is, how are we addressing these things that are underlying issues that were already there and may continue to be there even after the pandemic is over? Because ultimately, those things are going to continue to persist unless we, start working on that. One of the positive things I think I've seen come out of this as far as changing the way that people are addressing this is I've seen people have to be really creative about the ways in which they're reaching, historically excluded population groups. For example, like vaccine clinics, we started out by just opening it up to everyone, but then some people maybe didn't have transportation to get to the clinic. And so people were going into neighborhoods with mobile clinics. And we've seen that also with food access, with Gleaners. Gleaners has like an amazing food access van that they'll take around to the different neighborhoods and help people get access there. So they're using that same strategy that they use for social care to also help with medical care as well. So I think that's a cool, fun development. And I hope to see more of that grassroots effort to get people the care they deserve in the future.
Yeah, a lot of the most successful, I think, deployment of those mobile clinics, pop-up clinics, and other things have been in partnership with faith-based organizations. It's kind of a way to really target specific, kind of populations who have been underserved, but also to just gain trust. I think that's one thing we have to kind of understand, that whether it's talking about the vaccine or encouraging someone to sign up for coverage, sometimes we have to do that work, kind of laying that foundation, gaining the trust of a community before we can really get into the details of helping improve health.
So we've touched on a few things with regard to access, and I'm trying to pinpoint, and maybe it's impossible, but pinpoint what is the biggest issue when we're talking about access? Because I've heard mistrust. There's the physical access of we don't have a lot of community centers within our areas. Income plays a part of that. So is there one overlying issue that's the biggest problem when we're talking about access, and especially, I guess, as we're talking about income disparities?
I can't really pinpoint one because they all are so interconnected. I think if I had to, I feel like trust is the biggest one, because without that, you have nothing. And from that comes other opportunities for learning and engagement and, building trust in those communities. My background before coming to Find Help was, like I mentioned, working at the Bonner Center and doing community engagement and outreach, working on our quality of life plan and on our community-based crime reduction work, basically listening to neighbors a lot of the time. And so much of that also, that trust comes from helping people to build trust in themselves and helping them to realize that they are worthy and valid of the things that they want, right? Everybody wants the same things in life, right? They want to have a good education, and they want to have a safe place to live, and for their families to have opportunities. And, everybody wants that, right? But the access to that is so few and far between for some groups. And sometimes people have this kind of self-fulfilling prophecy that's been told to them of like, well, you don't deserve that because XYZ things. And so helping them to recognize that not only do they deserve it, but here are the options for you to actually access that and build that for your own family. That is groundbreaking when you're able to have those conversations with neighbors.
I mean, Alicia does this every day, so she knows much better than I do how to make those connections. I think, access is always an issue, but I look at, just for example, what Community Health Network has done. I mean, so many investments in communities to deploy access points. But, as Alicia said, that could be a tree falling in the forest that no one might hear if there isn't that trust, and that those initiatives aren't interwoven into the community at large. And I know there's a lot of work to do that, but there needs to be just as much focus as there is with, creating a new outpatient center or creating a new, healthcare facility. It's got to be, the community has to feel that it's part of their community. So
I'm going to ask each of you about some of the work that you're doing in this regard. And Alicia, I'll start with you with findhelp.org. First of all, talk about what are the resources that are there that people can find. And the other part is, where does Central Indiana fare compared to other states in the Midwest?
like you mentioned at the beginning of the podcast, findhelp.org is a nationwide social care network that lists social services for people to connect to with dignity and ease. There's over 1,300 resources in each and every county in Indiana. Obviously, in urban centers like Indy or Evansville or Fort Wayne, there's more resources available. But what we're doing with the network is that organizations like the Bonner Center or faith-based organizations that provide ministries or services to people in the community can actively participate in supporting our neighbors get connected to care through the network, through the platform. So anybody can go on Find Help or on, got to throw a shout out to Community Health Network's Community Connections. It is a Aunt Bertha / Find Help powered platform. And anybody can go in there, search by their zip code, and get connected to resources like food, housing, help paying for utilities, legal aid, going back to school, job searching, transit. Anything that is a free or reduced cost resource is available to be listed and for people to access on the website. The tough thing has been historically, and coming from that sector, getting those organizations to talk to one another and getting them to see like, oh, here are the crossovers that we have in our work. How can we, instead of competing for funds with each other, leverage those funds best and the gaps in services to make sure that people are actually getting the care that they deserve. So I would say we're very coordinated compared to other parts of the country, but we still have a lot of learning and things that we can do together. And that's why I'm excited about our work with Find Help.
Do you find that more people are finding Find Help or finding these platforms most recently, especially during the pandemic, or are they reaching out a little bit more?
Yes, absolutely. And it's a good thing, right? Because you're excited that people are finding resources and getting connected. But then also, like you mentioned, the amount of people that are in this position for the first time has also increased, which is troubling and concerning. So on one hand, we're very excited that people do have those resources at their fingertips. I also know 211 has been doing such an amazing job of getting their resources out to people, especially with the vaccination effort. And for us, it's all about what doors are available. Just go in whatever doors you have to receive access and care. We want to make sure that people get connected with dignity and ease, no matter if they're going through 211 or Find Help or just their local church or community center. But the number has been increasing, and we do want to keep an eye on that and make sure that we are also using those numbers and that data to advocate for policies and funding and everything that's needed to address those concerns.
Yeah, and speaking of advocacy, Brian, I know that's a lot of the work of the Hospital Association, especially with regard to our lawmakers. Mm-hmm. You talked about the expansion we've had in getting people insured. What else can and is your organization doing, working with our legislature, working with hospitals around the state to get access to the people that need it?
I think, this last session was an example of that. I think there was a recognition that in the budget that state lawmakers wrote that it was a time to invest in mental health and behavioral health, that the pandemic has also created exacerbated disparities there, and that access is important, but also some significant funding for new kind of public-private health initiatives. So looking at pilot programs are also just continued funding for those that have been proven successful, and programs that are like the ones that Alicia's talking about. I think so. We work with lawmakers, of course, the state of Indiana as well, and it's been a huge initiative of Governor Holcomb to focus on reduction of infant maternal mortality. And I think what we've learned, and certainly the state has made significant strides in that area, is that what patients certainly need medical care. And thinking about Central Indiana, there's world-class clinical care available here. Where I think another thing that we try to do is not just working on the public policy side externally, but working with our members across the association to also get better at making those connections from the clinical treatment over to those public and public-private partnerships, like what Find Help offers and others. So right now, when patients come in, they're often their medical condition, their clinical condition, that's all recorded, and that data, of course, is reviewed in the electronic health record, and we've spent many, many billions over the entire country to invest in those systems. But what I'm most excited about is now we see, and we're working on this with the Hospital Association, is encouraging documentation of those social needs in that medical record using certain codes now. And then when individuals who are overseeing the clinical care of that patient say, you know what, not only does this patient have, let's see, COPD or some medical condition, but they also have these other needs. They have these societal needs, these economic needs. And then not only can the physician and the care team guide them through what they need to do to get healthy with medication and exercise and further treatment, but you know what? You also need to go to this service. And groups like Alicia's make it really easy then for those folks to navigate and find what they need to get their rental assistance, to get transportation so they can make it to that follow-up appointment. I think one of the things we really focused on at the association is taking all of those programs and really trying to link them as much as we can to the outstanding medical care that's provided here in the community.
We talk about getting access to care is one thing, and that's certainly the most important thing, but then getting the same level of care across the board, no matter your income. How are we doing in that regard, and how can we make sure that that's happening?
Well, I do think we need to do more to lower our uninsured rate. I'll let Alicia kind of speak to how she sees it from from the field. Admittedly, I look at it a little bit more from the macro level as we look at our state and how it compares to others. But I'll go back to coverage where I started. We are absolutely blessed to have a program like the Healthy Indiana Plan. But when I look to some of our neighboring states, like Michigan, for example, we have twice the rate of uninsured as they do. So while we have this great program, there are other ways to connect people to coverage. And I do think as an entire state, we can do a better job of decreasing that rate of the uninsured.
Yeah, and I would echo that too. I definitely believe that we have room to grow. But at the same time, I am encouraged by the work that has been done and how communities, especially in light of COVID-19, are coming together to address this. A lot of the work that I do, like I mentioned earlier, is like rooted in community organizing and making sure that we're working at very grassroots level with people to share information. But information is a wily beast sometimes, and getting information about how you can access services. I feel like I have a bullhorn all the time, just really annoying people and reminding them of all the resources that are available. And here's how you can get connected, or here's where you can get vaccinated, or all the different things that we're trying to promote. So I think really investing in those communication networks and those trusted individuals that already have good relationships in those communities to kind of encourage people to make those decisions, that's going to be a way to improve that in the future. We've seen this with something that I've heard referred to as the promotores model, where you have health promoters that are local residents that are hired within their communities to advocate for, certain policies, or just educate people about what's going on and how they can get connected to, Healthy Indiana Plan, or here's where you can get some social services or food access, and having those people be the cornerstone of the community that they already are, but leveraging their trust and empowering them with information to share with their communities. That's something I'm starting to see organizations do here in Central Indiana, and I'm really excited about the possibilities there.
Well, you both are wonderful advocates for health and for healthy outcomes and for access. So for those who are listening, for individuals, in their day-to-day, what is it that they can do to be part of the solution to get more Hoosiers access to healthcare, especially those with lower income?
I could start and say your voice is powerful, and your knowledge and your network is powerful. I feel like, especially here in Central Indiana, we're like 1 degree of separation from anybody. And so just sharing with your networks the resources that are available, resources like findhelp.org or community connections, letting people know when they're searching for something that those resources are available, that they can search for anything on those sites. That's a huge first step. But then also just the advocacy piece of not being afraid to use your voice to reach out to your elected official, or to reach out to, leaders within your church or your faith organization, to be like, what are we doing? What are we doing to support our neighbors? How can we better be doing this? And then, of course, the whole legislation piece, just being aware of what's happening locally, both here in Indy and surrounding counties, and advocating again for our neighbors when you see those opportunities come up.
Well, we do a lot in advocacy, and I will just say I appreciate that message. That's exactly what we would want to share is, asking everyone to support public policies that keep programs like this, like the Healthy Indiana Plan and many others in place. But I think also just sharing within your network resources like Find Help and others. So your church, your school nurses, and guidance counselors and others. I mean, there are people that for whom a tool like that could be really helpful. I mean, who knows what sort of connection they may make with a student or a family through a conversation. And when you have tools that make it easy, these kind of one-stop shops for people to find all of those supports, then you can help many people by just sort of passing that information along. The systems that we've created, they sort of can be complex, and I think that's happened over time. But what's exciting to see are projects like whether it's using 211 to help with our vaccination rate, or Find Help and Aunt Bertha, these other systems that have taken all that complexity and now tried to simplify and streamline it. So we can just say, you know what, when we have a patient that comes into one of our facilities, we're going to address these medical needs, but they have all these other needs, rather than have that be a kind of a burdensome or a complicated process. You can just sort of send that person through one door, and beyond that one door, all of the different, vendors, like in a mall, that they're there, that they can then help address those specific needs. So I think we really are in kind of a new era of being able to serve the whole, not just the whole patient, but the whole person in our system.
Well, Brian Tabor, Alicia Baker, thank you so much for all you're doing for communities, for all you're doing to advocate for healthy outcomes and to provide access. And thanks for your insight today.
Thank you.
Thanks for having us.
I'd like to thank our guests for being part of today's discussion, and thank you for being part of our journey as we all become better listeners. I'm Chris Kirschner, and this has been Tell Us Where It Hurts. Until next time.